Hello, my name is Jennifer Cox and I'm one of the NICU nurses at a local hospital. I'm here today to present to you a program on safe sleep and back to sleep. Sudden infant death syndrome is an ongoing health concern in communities where increased risk established in subsets, such as premature or low birth weight infants, are concerned, or low economic areas as well. Often these issues are addressed in patient education to families prior to the infant leaving the hospital. Education to caregivers includes maintaining a close and separate sleep surface for infants with a safe environment free of soft bedding, extra blankets, or loose items. One of the main focuses of this education is teaching caregivers to place infants on their backs for sleep. These interventions are aimed at decreasing the risk of accidental issues that could interfere with the infant's ability to maintain their airway and breathe properly. Because it is thought that asphyxiation is one of the main causes of sudden infant death syndrome, these issues continue to be of concern. Following the program that we're about to present to you, we hope that the parent or caregiver will be able to state the infant should be placed in a supine or back to sleep position unless otherwise instructed for medical reasons. They should be able to repeat this 100% of the time that they are asked. Parents or caregivers will also state that the infant should be placed in a safe sleep environment on a firm, infant-appropriate area with no loose hazards. The program participants will also be able to describe a safe sleep environment and what the differences between an unsafe and safe sleep environment are. Why is safe sleep important? All infants need to follow safe sleep guidelines unless instructed by a qualified health professional to follow a different guideline. Safe sleep guidelines have been shown to decrease the incidence of sudden infant death syndrome by preventing interference with an infant's airway and breathing. Some infants are at increased risk for sudden infant death syndrome. These infants include premature and low birth weight infants, and infants born into low economic areas where safe sleep environments may not always be easily obtainable. According to Healthy People 2030 and Sudden Infant Death Syndrome, there are 3 focus goals to address this syndrome and infant mortality in the United States. The first goal, the MICH-14, is a goal to increase the proportion of infants placed on their back to sleep. The MICH-D03 is a goal directed towards providing a safe sleep environment that is close to, but not with, a caregiver. And the MICH-02 is a goal to decrease the infant death and loss. The most important start to this program is that we learn to place the baby on their back to sleep. Current guidelines suggest that placing an infant under the age of 4 months, in particular, on their backs while sleeping reduces the risk of sudden infant death syndrome. Babies should be placed on their backs with only a swaddle or sleep sack, preferably a sleep sack because they have a reduced risk of getting out of the sleep sack and rolling over. Safe sleep locations. Safe sleep locations should be close to, but not with a caregiver. These locations can include a bassinet, a pack and play, or a crib, including places such as the UK started a program with safe sleep boxes with a small mattress in it that had some baby supplies in it. Once all the baby supplies were removed, you could use that safe box as a bassinet for the first few months. This particular intervention has helped. Here in the US, we have bassinets, pack and plays, and cribs, and some programs that will allow you to obtain these items at reduced cost or sometimes even for free if you are not able to access them on your own. The infant should either be swaddled or using a sleep sack on a firm surface with no extra hazards in the sleeping area. Our particular hospital provides you with a sleep sack upon discharge that we send the baby home with so that you are able to start safely by providing them with a safe sleep swaddle. All extra loose extra stuffed animals, pillows, blankets, or other items should be removed from the sleep area. Remember, it's just baby, nothing else. I provided you with two pictures here. The safe sleep area, which is presented to the right with both babies in sleep sacks, one with sleeves, one without, with nothing else in the crib. I've also shown you an unsafe picture. This basically breaks every rule against safe sleep. If you take a close look at the picture, you can see that the infant is placed on their stomach or prone position, which is not desirable. There are bumper pads up along the crib. There are several extra blankets, a stuffed animal, and pillows. These all provide risk factors to maintaining the baby's airway and therefore deemed unsafe. The safest environment, though it may not be as cute, is just baby in a sleep sack or swaddle by themselves in the crib with no loose fitting blankets, pillows, or extra obstacles. The other thing that we need to address in this program is to maintain a separate but close sleeping area. It is unsafe to have the baby sleeping in a bed with you, on you, in a chair, upright. While you are not conscious and not awake, it is not safe to have the baby in a position where they could be dropped, rolled over upon, or asphyxiated, having their airways compromised. If you look at the unsafe picture, which shows a father sleeping with the baby and a pet right next to the baby as well, in a adult-sized bed with pillows, loose blankets, and other obstacles that could disrupt the child's breathing. This is not safe. If we take a look at the safe picture, you see that this mother has provided a bassinet with just baby separate from her in their own area, but close. She could still monitor the baby, wake up and check on the baby, but the baby isn't in a position that's going to compromise any airway or breathing issues. We're going to now complete two activities. In this first activity, we will present you with the opportunity to practice placing baby on their back to sleep with either a safe swaddle or a sleep sack of your choice. You may choose to utilize the bassinet, the pack and play, or the crib if you like. We will practice with the baby dolls, and you can show us exactly how you should be placing the baby in their crib, avoiding the prone position and only putting them on their backs. You will also be asked to provide the main reason why we place the babies on their backs, unless otherwise directed for medical reasons. And this is basically to maintain their airway and to limit any issues that they may have with maintaining breathing. Welcome back. Our breakout activity number 2, you will now be asked to correct unsafe sleeping environments and make them safe sleep compliant. In this activity, you will be provided with 3 unsafe environments and asked to fix the location or environment to make them safe sleep compliant. You may be presented with a situation where a parent may be sleeping in a bed with a child with several obstacles around. You may be presented with a bassinet, pack and play, or crib with several obstacles in it that need to be cleaned out. Between these 3 environments, you'll be asked why you should be providing a safe area close to but separate from a caregiver on a firm, clear of obstacles mattress. Thank you for participating in today's program. If you would please fill out the evaluation of the program so that we can improve upon this program in the future, it would be greatly appreciated. I'm going to provide a reference slide for anybody who wants to read more on why we do what we do in order to maintain safe sleep environments for our infants. And if you have any questions, please feel free to contact me. Thank you.